In the heart of Amhara region, South Gondar, Addis Zaman, and Oromia region, North Shoa, Mukituri areas, children and families facing life-threatening, severe chronic, non-communicable conditions now have hope.
Maqaan koo Darribee Sanbatee tan jedhama. Gandi koo Mandus Maaliidha. Waradaan immoo kanuma caale. Dhuguma mucaa kana achi buufata Boriyan jedhamurraa. Dhaqnaanii mucaan kuni asina dabarsanii mucaan kuni sukkaara isaa asitti irratti achitti garuu odoo hin beekne guyyaa baay'ee dakkamaa ture. Odoo garanatti dhufee naa taakkamee naa argadhee kanarraa misgaanaa kanarraa argachuu baadhi mucaan kun yooti isaatu hin dabraa akkanaa.
This is the story of Pen Plus, a revolutionary initiative giving voice, care, and dignity to those long underserved.
Pen Plus is an innovative, cost-effective strategy adopted by WHO, designed for developing countries in general and Africa in particular, and endorsed by WHO Afro in 2022 meeting held in Lomé, Togo.
The Pen Plus initiative decentralizes high-quality care for severe chronic non-communicable diseases, including type 1 diabetes, rheumatic heart disease, congenital heart defects, and other complex conditions to primary hospitals in rural areas.
Since the launch of Pen Plus clinics at Mukaturi and at Addis Zaman Primary Hospital, in these two clinics we have enrolled more than 750 patients with severe chronic non-communicable disease. Most of these patients are children and young adults with type 1 diabetes, rheumatic heart disease, congenital heart disease, and other complex NCDs.
The program has led to improved treatment adherence, better glycemic control as measured by the HbA1c, reduced complications and hospitalizations, and in some cases, access to life-saving cardiac surgeries. Most importantly, patients are now able to receive high-quality, comprehensive care closer to home, eliminating the need for long, costly travel to distant referral hospitals.
From technical perspective, the Pen Plus model is effective in managing severe chronic non-communicable disease since it helps in decentralizing the services from tertiary hospitals into the primary healthcare facilities, especially the primary hospitals, through mid-level healthcare professionals due to the capacity building trainings conducted regularly, and they are now more confident in diagnosing severe chronic non-communicable disease and managing severe chronic non-communicable disease at primary hospital level.
By equipping existing mid-level health professionals with training and tools such as point-of-care echocardiography and access to essential medications, the program enables these providers to deliver services that would typically require referral to distant tertiary centers.
After this project coming to our hospital, the big improvement is the better patient outcomes. We reduce repeatedly admit NCD patients. Our doctors are enough training by this project. They fully confident to treat their patients because of they have experienced and got enough training. They have adequate laboratory tests. They have adequate medication in the supplies, and supported by Matthews Sundu Foundation.
I'm highly confident to manage a severe NCD case like type 1 diabetes rheumatic arthritis because of my Pen Plus advanced training and echo and spirometric training and clinical hands-off clinical experience working for a long duration.
Sanin dura tamaaru bishaan dhoobota hiyoo galeen dadhabaa maal meedhee gaafa asitti achirra waliirraa dabree dhufu sukkaara jedhame.
Before introduction of Pain Plus initiative to this hospital, most of our severe NCD case patients had traveled to long distance to referral hospitals, so that leads to delayed care, poor follow-up and complication. After the implementation of Pain Plus initiative to this hospital, we start to provide this specialized care to this hospital, so we reduce significantly hospitalization, complication and lost follow-up, also school absenteeism.
Beyond clinical care, the initiative integrates vital social support services. Patients receive home glycometers with test strips, transportation assistance, school materials for children, support for enrolling in community-based health insurance, and access to previously stocked out medications and diagnostics, and even food assistance for families facing food insecurity.
Amma garuu odoo hospitaalli kun dhiyeenya kanatti argamuu baate dhuguma gara biraa deemee dhadaan dhadhu. Amma dhuguma odoon gizee ture polisii tokkollee karaa milikillee xuqur masaattillee dhaqeen ikka. Gubbaa kan achi geessutti dhaqanii hin qabu. Dandeettii akkasii hin qabu. Yoos gizee har'a immoo qarshii isaan deemellee achitti odoo jidduu kanatti dhiyeenya kanatti nu argamuu baate mucaa kana achillee deemee dhaqanii hin qabu achitti asaakamee adaannachuu hin danda'u. Baay'ee jidduu dhiyeenya kanatti argamuun isaa baay'ee na gammachiisadha. Maashiniin illee kennamee fi maashiniin illee laallatee qoricha illee gizee maashinii isa hin laallatu. Mucaa sila barumsa qabu hin barreeffata. Yoo immoo isa fidee dhufe asitti ilaalamee qoricha jijjiirama illee kennameefit. Deebi'ee baay'ee naan kabakkabaniiti amma irra ga'utti. Amma irra ga'utti yaa galatooma. Ashuraastiidhaan humaaduun kaffaliinan deebi'ee mooyyuu akka daftaraallee akka kopheellee deebi'ee waan dubbadhee boorsanii nafne deebi'ee mooyyuu lifoormii nafne tiraanspoortii mallee nyaata kootillee naaf kaffalanii tani kana gargaarti isaan na gargaaraa jiran. Mucaan kun fayyee raawwatee asitti nyaanni illee na danda'anii hunda isaa na danda'anii odoon homaan kaffalle qabeenyi kiyya kun immoo silaa hani sanaasa adaanu isatti caafiidhaan gahu ashuraastiidhaan gurbaan kun fayyee ka'ee timirtii ofitti naadee bara 2016.
Maqaan kiyya Mastaawot Tashooman jedhama. Kanan jiraadhu asuma magaalaa Muka Xurriidha. Dhukkubni kiyya sukkaara taayippii tokkoffaadha.
In a past facing challenges and hopelessness herself, Mastaawot now stands as a volunteer peer leader in Pain Plus Clinic. Living with type 1 diabetes, she has transformed her personal journey into a source of hope, guiding others through peer support and reminding them they are not alone. In Pain Plus clinics, stories like Mastaawot's turn fear into strength, empowering peers to manage their condition and stay committed to treatment.
In order to ensure sustainability and quality, improve the quality of the services being provided at primary hospitals for severe non-communicable diseases, the subspecialists and other specialists at referral level hospitals should provide continuous mentorship and capacity building training to the physicians or other mid-level healthcare workers. Moreover, equipment infrastructure should be availed to this hospital. That means allocation of finances towards improving the diagnostics equipment and the infrastructure of the Pain Plus clinics or the NCD clinics at primary hospitals level is also important because without the necessary diagnostic equipment and other infrastructure, it's not possible to diagnose and manage severe non-communicable disease effectively and in a sustainable manner.
We highly value the technical as well as the financial support provided by NCDI Poverty Network. On top of that, we are also very closely working with local partners like Ethiopian Diabetic Association, and also we are closely working with Ethiopian Heart Association in different professional and specialties. So the collaboration is very important to consolidate this Pain Plus initiative. And on top of that, we are also very closely working with the Ministry of Health and with the regional health bureau like Amara and Oromia regions. And this helps us to demonstrate Pain Plus initiative is feasible in Ethiopia, like other African countries.
In order to scale up the Pain Plus program, now currently only 2 primary hospitals are implementing the Pain Plus program. So in the upcoming year, we have planned to scale up into an additional 8 primary hospitals. So as a result of this, we are currently developing the National Pain Plus operational plan. We are in the process of finalizing the National Pain Plus operational plan. It's already accepted or approved by the Disease Prevention and Control Lead Executive Office.
Thanks to financial and technical support from NCDI Poverty Network, and with the leadership of Ministry of Health, guidance and direction of health bureaus from Oromia and Amhara region, the evidence shows that we have succeeded in providing up to the standard care for selected chronic diseases and NCDs at primary hospital, and it is now time for scale up, and thanks to the leadership of Ministry of Health, we have successfully developed a national operational plan. A scale up requires more than 60 million USD budget for about 6 years. And we call upon our partners and invite multilateral, bilateral and development partners to join and support us in whatever way they can, so that we will be able to provide up to the standard treatment at 150 hospitals all over the country, and so that we will be able to save our people, in general, particularly the young ones, from being affected and dying from preventable and treatable chronic disease and NCDs.
Lives are being saved, futures are being rewritten, but thousands more children and young adults are still waiting. Join us in expanding the Pain Plus initiative to every corner of the country.